Welcome back to Local 4 Live. I'm Priya Mann in for Nick Monticelli this morning. Plenty of conversations are coming up in the next half hour. Plus, we're getting a live look out at beautiful Belleville this morning. There are no more air quality alerts, but Ashley is tracking a chance for storms later today. We'll get to her full forecast in just a few minutes. Meanwhile, the Michigan Department of Health and Human Services is sending out a warning about a dangerous drug that's made its way back to Michigan. We're talking about the drug Carfentanil, originally developed for veterinary use with large animals. The opioid is about 10,000 morphine and 10,000 times more powerful than morphine and 100 times more potent than fentanyl. And between January and June, 11 deaths involving Carfentanil were confirmed. Now, none of the deaths were positive for the drug alone. 10 tested positive for cocaine, and fentanyl was found in 8 of those cases. And in previous years, Carfentanil contributed to numerous deaths across Michigan. Here are some of those numbers. In 2016, the drug contributed to 107 deaths and 111 deaths in 2017. Now, between 2018 and 2022, there were less than 5 Carfentanil-related deaths. And the rise of the drug has the MDHHS on high alert. And joining us this morning to talk about it is Michigan's Chief Medical Executive, Dr. Natasha Bagdarian. Thank you so much for joining us.
Thank you for having me on.
So why don't we just start? We've heard a lot about fentanyl. We've heard a lot about opioids. What is Carfentanil?
Carfentanil is another opioid. It's another synthetic opioid like fentanyl, but it's much, much more potent, which means that it can be more addictive, it can produce greater effects, and also the risk of overdose is much higher.
Now, when we're talking, like I've seen images when they show fentanyl and how much it could take to be lethal. I mean, you almost can't see it with the naked eye.
You actually, not only can you not see it with the naked eye, the amount is so small, but you don't know what is in any sort of pill or powder that you're buying from a non-healthcare setting. So there are drug dealers out there who are manufacturing pills that look exactly like things like Vicodin, things like oxycodone. So you can buy a pill thinking it's one thing, and there could be other really toxic compounds that are contaminating those substances.
And there have been heartbreaking stories of like students buying what they thought was Adderall, and then suddenly
absolutely.
It's a fatal dose.
The message for the public here is that if you're buying any kind of pill or powder, again, from a non-healthcare setting, you have no idea what is in that substance. You could think you're buying Adderall, Vicodin, oxycodone, and it could be something entirely different, something much stronger, something that your body is not used to, again, setting you up for risk for overdose.
And you said the broader issue here is supply.
The broader issue is that the supply is much more dangerous than it's ever been before. Carfentanil is one of those contaminants, but there are other contaminants as well. Things like xylazine, medetomidine, other veterinary tranquilizers. And what we're seeing with the illicit drug supply is that these products are going through multiple hands. They're going through multiple hands before they get to people who are purchasing and then using them. And those multiple hands, those multiple steps, these drugs are being cut with different kinds of cutting agents, and they're being contaminated not just with one product, but with multiple products along the way. So people are buying things that are a whole mix of drugs, and they have no idea what is in those compounds or how much is in those compounds they're buying.
Why do you think we're seeing a reemergence of this one?
It's really hard to tell. So you mentioned in 2016 and 2017, there was a peak in those Carfentanil-associated deaths. And then Carfentanil seemed to disappear from the drug supply scene for many years. Now, why that happened, we don't really know. It could be an availability issue. It could be that drug dealers were seeing more overdose deaths, and so they backed away from that as a cutting agent. The reason for why it disappeared is less important. The main issue here is that it's back. And there are other contaminants. They're all being mixed together. And not only is the drug supply more dangerous than ever, you can't tell what is in drugs that you're purchasing. And I want people to know that there are tools that they can use to save lives and reverse drug overdoses.
So the one that we've heard a lot of is Narcan, but the other one is naloxone?
So naloxone is the generic term. It's the same thing as Narcan. This is the kits that we give away all over the state for free.
Can we see it?
Yes. So not only can you get a kit like this at a harm reduction agency pharmacy pretty much anywhere around the state, but we also have a portal where you can request for kits like this to be mailed to your home. And inside are 2 nasal sprays.
Okay.
So a lot of people assume that a medication like this is an injectable medication. It's not. It's super easy to use. It's just a nasal spray.
Okay.
And this is a medication that not only is life-saving, so what it does is it actually binds to the same receptors that carfentanil or fentanyl will bind to. The opioids, fentanyl and carfentanil, they actually cause what's called respiratory depression.
Okay.
They stop people from breathing. And these medications, Narcan or naloxone, they bind to the same receptors and they get people breathing again. So they can start people breathing again until folks can get medical help. So the key thing to do is if you suspect someone is having an overdose, is to give them a dose of this naloxone.
Okay, and it's easy to administer?
Easy to administer, just a nasal spray.
Just a nasal spray,
So
okay.
2 squirts into a nostril. You can repeat a dose every 2 to 3 minutes.
Okay.
And call 911 so that this medication reverses some of the effects until medical help can get on site.
You know, if you had told me like 15 years ago that we would have an antidote like this that's available for people to purchase as a safety mechanism, I don't know if I would have believed you.
Not only is this available to purchase, this is available over the counter. It's
Right.
available for free for anyone who wants it. And it's really important, I think, that we get it out into as many hands as
Yeah.
possible. So you may not be someone who is using illicit drugs or street drugs. You may not think anyone in your inner circle or in your family is using them, but you never know.
No, absolutely.
You could have an elderly family member who's on a prescription medication who takes a little bit too much.
Yeah.
You could have teenagers in your home who have purchased pills from a friend
Right.
and being told that it's one thing when actually it's something else. So having this on hand can save someone's life.
And I think that's a good reminder too. I mean, substance abuse disorder, there's a spectrum. I think we have an idea of what somebody suffering from drug addiction looks like, but it could be anyone.
It could be anyone. And in fact, we're seeing a lot of emergency department visits for teenagers.
Really?
We're also seeing a spike of overdose deaths in elderly men, elderly Black men in particular, over the age of 60. So we're seeing a whole spectrum of drug overdoses and the impacts of things like opioids. And I just want to make sure that people know there are tools that they can
Yeah.
receive for free.
You know, this was important enough that you put out a press release for it, kind of drawing people's attention to it. What was your first thought when you saw some of these numbers and that starting to go back upward?
Well, you know, we've been really successful in the state of Michigan. We have reduced our overdose deaths tremendously. We're actually in the top 5
Really?
best performing states in the entire country for that reduction. We've reduced our overdose deaths between 2023 to 2024 by 36%.
Because of Narcan?
That's one
Or
of the
naloxone?
reasons. That's one of the reasons. So we've put out 1.3 million naloxone kits in the last few years. We have tens of thousands of reported uses of these kits.
Yeah.
And even if you're not using a kit, having it on hand, it's sort of like having a fire extinguisher on
Sure.
hand.
Yeah.
You hope that there's never a fire, but if there is one, if there's an emergency, you know that you've got this life-saving tool in your back pocket.
That's it. I had not heard those numbers about where Michigan falls. You know, when you look at that we're now in the top 5, how does that make you feel?
We're really proud. We're very
Right?
pleased with the progress we've made, but there's a lot of work to do.
Yeah.
So at the peak of the opioid pandemic, we were losing about 3,000 Michigan lives every year to drug overdoses. That number's come down to 2,000. So huge
yeah.
improvement there.
A third,
But those 2,000 people, those are people's loved ones. Those are family members, friends, parents, community members, neighbors. So we've got to remember that there's a lot of work still to be done. And there are some challenges right now. Public health is facing cuts at the federal level. We're facing a lot of challenges in terms of staffing, in terms of funding. And so we need to make sure that we continue to advise the public and give them tools like naloxone so that we can continue this forward movement.
You know, it's not every day that we get to talk to the state's top doctor. What would your final message be for folks who are watching this?
You know, I think it's important for folks to know, for this issue in particular, that the drug supply is more deadly than ever. People can overdose after a single use of a drug because of all of these contaminants. Which contaminants are in the drugs are less important, but I just want folks to know that there are tools out there, tools like naloxone. I encourage everyone to take a look at our website, take a look at our portal, and keep this medication on hand. Since I've been involved in this work, I actually keep one of these kits in my car glove compartment,
Really?
just in case I run into someone who might need it.
And it's okay with all the fluctuating temperatures and stuff? It'll
It's
be good to
actually
go?
a medication that does pretty well at high and even low temperatures. So keeping it on hand is a really good first step.
So you really have no excuse. All right, I'll keep this one close by. Thank you, Dr. Bagdarian. Appreciate you coming in and talking with us today.
Thank you for having me on.